I'm pleased to be joined today on Health Beat by Dr. Aubrey Mwinyogle, a vascular surgeon at Faith Regional Physicians Services in Norfolk. And today we're talking about abdominal aortic aneurysms. So if you would, tell us about the management of this.
Thank you very much. So the management of AAA or abdominal aortic aneurysms depends on certain criteria. First of all, if the patient is symptomatic. Then secondly, the size. If you're symptomatic, you get a repair. If you're asymptomatic, then we depend mainly on the size. And the size threshold is just based on the risk of it rupturing. So for women, the size threshold for repair is 5 centimeters.
Okay.
For men, it's 5.5 centimeters. So what if you're asymptomatic and you've not reached the size threshold? Basically, we tend to monitor you with serial imaging, which could be an ultrasound or a CT scan. And of course, we try to modify some of the risk factors that predispose you to it, with smoking cessation being the major one, and control of your hypertension and cholesterol. Now, if you've reached the threshold for repair or you're symptomatic, there are 2 major ways we do this. Either an endovascular approach or an open approach.
Oh.
The endovascular approach is minimally invasive with a quick recovery time. So typically what we do is we go into your blood vessels in the groin with certain sheets, and then we put in a device, which is like a pair of pants, that line your aorta and prevent your pressure in the aorta from going onto the walls to cause a rupture.
I see.
The other approach is the open surgery, where we make an incision in your belly, expose the aneurysm, cut it open, get it out, and then we replace it with a piece of synthetic material.
Well, thank you so much for being here today. We appreciate it.
Thank you very much for having me.
You bet. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.